Hello, my name is Joshua Priestley and my company TPC Benefits located in Birmingham, Alabama. We manage the health insurance and benefits at Chester's Chicken. Today in this video we will be reviewing the 2025-2026 health insurance overview that takes effect October 1st. We will be offering two brand new Blue Cross Blue Shield of Alabama plans, an Alliance secondary insurance supplement, and then the telemedicine benefit that will be attached to the secondary insurance plan. The secondary insurance, this benefit will be $6,000 for the employee and $6,000 for the family. So the family would have a total of $12,000 of benefit that will be used to cover your out-of-pocket expenses related to the PPO Blue Saver 4000 plan. The secondary insurance is designed to cover your calendar year deductible, your co-insurance, your emergency room cost, outpatient, inpatient, physician and facility cost, labs, pathology, diagnostic tests, ambulance, durable medical equipment, chiro, physical therapy. It even pays for mental, nervous, and substance abuse. The secondary insurance will not cover the office visit copays, so if you're on the Blue Saver 4000 plan, the PPO option, you will pay those office visit copays, but anything that takes place in the doctor's office, any type of surgery or stitches or EKG, MRI, any type of procedure, the secondary insurance would cover that. The secondary insurance does not cover the prescription drug copays, so you do not lay down your secondary insurance card at the pharmacy. Blue Cross Blue Shield of Alabama covers preventive care at 100%, and then any elective medical procedures or non-eligible expenses, the secondary will not pay that because Blue Cross will not pay it either. The secondary just piggybacks off of the Blue Cross Blue Shield network. If it's an eligible charge by Blue Cross and it's a covered expense, then the secondary insurance will pay 100% of the time. There are no pre-existing conditions, and the providers file the claims. So we will be offering two brand new Blue Cross plans effective October 1st. The first plan on the left, it says HSA 4000. This is a $4,000 deductible plan, but this is HSA compatible. So anybody that has a HSA plan now, they'll be able to keep that same HSA. And then we would elect the HSA 4000 plan, HDHP 4000 plan, and the deductible's $4,000. Your out-of-pocket max is $6,000. The out-of-pocket max for the family is $12,000. And then you can fund your HSA plan accordingly to help cover your deductible and your out-of-pocket expenses and co-pays. The second option that we have will be the Blue Saver 4000 PPO option plus Alliance secondary insurance. Alliance secondary insurance does not qualify with the HSA plan. You would only get the Alliance secondary insurance supplement with the Blue Saver PPO option. And this plan has a $4,000 deductible as well, $8,000 for family, $6,800 out-of-pocket max, and $13,600 out-of-pocket max for the family. Once you reach your out-of-pocket max with both plans, then Blue Cross covers all expenses at 100% for the rest of the calendar year. The $6,000 bucket of money, which is the Alliance secondary insurance supplement, you will have $6,000 for the single and $12,000 secondary insurance benefit for the family. The office visit copays on the Blue Saver 4000 is $45 for primary, $65 for specialist. There are copays for the prescription drugs that will be first dollar coverage. Tier 1 generic drugs will be $15 or less for a 30-day supply. Tier 2, $60 copay. Tier 3, $100 copay. And those specialty drug copays would be $425 or less for a 30-day supply. All copays listed here are a 30-day supply. If you pick up a 90-day supply, multiply that copay times 3. In the gray column that we are reviewing, everywhere it says $4,000 deductible, then 20%, $4,000 deductible, then 20%, $4,000 deductible, then 20%. That's where the secondary insurance pays on your behalf. After you give the provider both your Blue Cross card and your secondary insurance card, you have to give them both cards so they can photocopy both sides of each card and store it in the system, and then they will file the claims to both vendors. And the secondary insurance will pay your out-of-pocket expense up to $6,000 in a calendar year. Once you exhaust your $6,000 secondary insurance benefit, then you would owe the difference up to the out-of-pocket max. Let's look at some claim examples. Example number 1, dermatologist visit. If you're on the HSA 4000 plan in this claim example, you would owe $300, but since you would fund your HSA accordingly, then the HSA would pay that for you. In our secondary insurance, Blue Saver 4000 plus Alliance, you'd only owe $65 copay for the specialist, and then the other $150 would be paid by the secondary insurance. Example number 2, 2-day stay for a baby. The claim under the HSA plan would be $4,680. If you funded your HSA accordingly, then your HSA would pay that amount for you. With our secondary insurance plan plus the Blue Saver 4000 PPO option, you wouldn't owe anything, because if you gave them your secondary insurance card, and you have to remember to give them that card, the secondary insurance provider will pay $4,340, so you wouldn't owe anything. Same thing, example number 3, under the HSA option, the claim is $5,000. If you had your HSA funded correctly, would pay all that for you. Under our Blue Saver 4000 plus the secondary would pay all $4,500 for you. You would owe nothing. Let's look at the last claim. Worst case scenario, your out-of-pocket max under the HSA plan is $6,000. So since this claim is $225,000, you would reach your out-of-pocket max of $6,000. If you had your HSA plan funded accordingly, then your HSA would cover that $6,000. Under the PPO option plus the secondary insurance, the secondary insurance would pay the full $6,000 because that's your benefit amount. That's your maximum benefit amount. That $6,000 would be exhausted, and then you would pay the remaining $800, which is the last $800 to your out-of-pocket max. Once you pay the last $800, your out-of-pocket max is reached, and every claim for the rest of the year is covered at 100% by Blue Cross. You don't owe anything. Every employee would get a brand new Blue Cross card, so be on the lookout for a brand new Blue Cross card in the mail by October 1st. And anybody that elected the PPO option plus the secondary insurance, you would also receive a brand new secondary insurance card that's going to have your name, member ID number, employer group number. The back of the card is how to file the claims. There's a payer ID number. That payer ID number is what providers look up to locate the secondary insurance provider to receive payment from them. And then once they locate that payer ID number, they can associate it with that address. Telemedicine is included with the secondary insurance at a $0 copay. You can talk to an in-state licensed physician over the phone for $0. They can diagnose and treat and send a prescription to your pharmacy within 30 to 45 minutes. I've used telemedicine 5 or 6 times this year. Once I was driving down the road, called the telemedicine provider. He diagnosed and treated, sent a prescription while I was driving down the road, and I went and picked up that prescription an hour later. And so the telemedicine is very easy to use, and it's free. I would encourage everybody that elects the PPO option plus the secondary to use the telemedicine as your first line of defense. And you can call that number 1-855-673-2876 to register over the phone for the telemedicine. And once you register, they can diagnose and treat, send a prescription to your pharmacy. Or you could register online at www.mwgtelemedicine.com. That's it for today's employee overview. And I appreciate your time. My name is Joshua Priestley, and I hope you have a great day.